Right. I'm going to keep the timer for you. So you have 9 minutes, Bhavana Kumari. And so when last 3 minutes is left out, okay. So I'll tell you like last 3 minutes is left, like, no. So just be careful about the timing. Okay.
Okay, sir.
So do you want to start now?
Yes, yes, sir.
Yeah. Start.
Hello, good evening.
Good evening.
My name is Dr. Bhavna. I am the one of the neonatal registrar here. Am I speaking to Eva, mother of John?
Yes, 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 doctor, you're right.
Okay, Eva, how are you?
I'm doing good, doctor. Thank you very much.
Okay, Eva. So today I'm here to discuss with you about your baby John. So is this suitable time for you?
Yeah, yeah.
Okay, so Eva, I'm here. Before starting, I will make an arrangement that nobody will disturb us. So do you want anyone else to be with us?
No, doctor, I'm alone now. You can speak to me.
Okay, so Eva, how much you are updated about the John?
Doctor, actually, John is, is born premature, preterm, at 29 weeks of gestation. And so there are problems, So today I found that the nursing staff was actually feeding a formula milk to my baby John. So I'm very upset about it, doctor.
Yeah, Eva, I can totally understand your concern, how much it would be difficult for you. So I'm here to discuss with you about this condition. So as you know, John was born preterm, and as at the night time, the express breast milk was not available. That's why our nursing staff gave him formula feed, and I'm sorry for that.
Doctor, so what do you mean by that actually? I struggle so much so, for expressing breast milk. And when I'm giving, express milk for my baby, so why nursing staff is giving, formula milk? Don't see
Yeah, because
understand
at
that
yeah,
the problems in the gut.
yeah, I really admire your knowledge. You have much knowledge about this, but as we are continuously monitoring the John, and the good thing is that John is currently stable, and we are watching him for any drawbacks of this milk as well. And I'm so sorry that at that time the express breast milk was not available, and there was a feeding time for John. That's why the nursing staff gave him a feed. Are you with me, Mrs. Eva?
I'm with you, Doctor. Then you were just trying to give some excuses so that okay, feed was not available and trying to feed with the formula milk. It's not done, doctor. And what if my baby develops that what is that condition called as something necrotizing enterocolitis? So who will be responsible? Do you want to take the
Yeah,
responsibility?
I'm so sorry you are feeling like that, but I'm reassuring you that currently John has no signs of necrotizing enterocolitis, and he is totally under our observation. We are keeping eye on him. If we suspect that if he develop any signs of necrotizing enterocolitis, we will intervene immediately. Are you with me?
Yes, yes, I'm with you, doctor. But yeah, so tell me what exactly happens in case of that necrotizing enterocolitis. So what should I look? What should we look for the symptoms? So what will happen,
Yeah.
doctor?
Yeah, that's a good question from your side. So for this necrotizing enterocolitis, we will look if the John has continuous throwing up, greenish color throwing up, and is there any blood in his poo, any tummy distension, if he is not taking any feed, and he becomes very drowsy. So then we suspect that the John has developed necrotizing enterocolitis. Are you getting my point, Eva?
Yeah, I'm getting the things. But doctor, like in case if John develops this necrotizing enterocolitis, whatever you're saying, So, is there any treatment available?
Yeah, there are multiple treatment options for this necrotizing enterocolitis, and it depends on there are multiple stages. So it's from mild to severe cases, but let me reassure you from the only one feed, one formula feed, there are very rare chances to develop the necrotizing enterocolitis, and there are multiple treatment options like we will give anti-bug treatment for this. Are you with me, Eva?
Yeah, I'm with you, doctor. You told like so one feeding with formula milk, it won't cause neck. But then what are the factors which can lead to neck, doctor, like necrotizing enterocolitis?
Yeah, if we are continuously giving the formula feed, and because as he was born before time, it is itself is a risk factor for developing the necrotizing enterocolitis as well. Are you getting my point?
Yes, I'm getting your point, doctor. But yeah, but this is not done, doctor. Actually, the how precious the mother's milk is for the baby, and I don't know why it was replaced by this feed formula feed. Uh, Doctor, I just want to do a complaint against the nursing staff. So, can you tell me what is the name of the nursing staff who has given the feed?
Yeah, I can totally
Last three
understand
minutes left.
your concern, but this is our hospital, and I'm not allowed to tell you any. I can't nominate anyone. So, as this incident has already been reported as well, okay,
Incident form is already it's raised.
reported.
Is it
Yeah,
reported?
and
Okay.
yes, yes, yes.
But why you're trying to hide, name of the nursing staff?
Yeah, it's not the whole. It's not the only one. Like it is as we are working as a team of the doctor. So it's not only the one person that can do this. So I'm so sorry that I can't nominate only one person. Are you with me?
I'm with you, but I think you were just trying to hide that person, the thing. Okay, so I want to meet your consultant.
Yeah, I will arrange a meeting with my consultant as soon as possible. Is it okay with you?
Yeah, that's okay. But at the same time, okay, I would like to do a complaint. Okay, so please help me with that.
Yeah, so I will guide you through the patient advices and license services. You can complain through as well. Okay.
Okay, okay, doctor, sure. All right.
So, do you have any other concern, Eva?
No, I'm just, very much worried about this gut complication.
I can totally understand that how precious John is to you. So don't worry. We are continuously monitoring the John, and we will again. We will again. I'm very sorry for that incident. So I will. So can I go through what we have discussed today?
Sorry?
Can I go through what we have discussed today?
It's okay. Yeah, no problem.
Yeah, so today we have discussed that John is given formula milk because express Bismol was not available, and I have told you about the sign and symptoms of the neck. And currently, John is vitally stable, and we are continuously monitoring him. And furthermore, I will provide you some leaflets about the neck as well, and websites. You can go through this and okay, so I will arrange a meeting with my consultant as well. So, Eva, do you have any other concern?
No, doctors, I have only concerns about the complications. So, yeah, I'm upset about it. Yeah.
Yeah, I can understand your concern, and I will, as soon as possible, I will arrange meeting with my consultant, and we can address your concern. If you have any query at any time, you can come back to me and discuss. Okay?
Sure. Thank you very much.
Okay. Thank
Okay.
you. Yeah.
Thank you. Okay, your time is on. All right.
Okay. Thank you, sir.
Right. Okay, so let's do the discussion part. Okay, so how was it?
I don't know. It was not good.
How you are saying it was not good? So,
Uh, I don't know. I think I was not completely addressing the concerns of the mother.
mm-hmm.
Yeah.
All right. Okay. Good. Okay. So let's try to get feedback from your friends. Okay. All right. Deepti, uh, did you attend the session since beginning or you joined in between?
I attended since beginning, sir.
Sure. Okay. So do you want to give feedback about Bhavana's performance?
It was good, sir. Like I think she addressed the queries. Maybe bringing up that if to arrange a meeting with the consultant if the mother was not satisfied and the mother was worried about the complications. So that could have been brought up earlier. Otherwise, I think she did okay. She addressed the queries also. In between, she was asking very frequently, maybe that are you following up? Like, are you getting what I'm trying to say? But otherwise, it was okay.
Okay. Thank you very much. All right. Sarika, do you want to give feedback? Anyone can come forward and give the feedback. Aarti?
Hi, sir.
Hi,
Good
Saravanan.
evening.
Good evening.
How are you, sir?
I'm good. I'm good.
Yeah,
Thank you very much.
I'll give my comment.
Sure, sure.
So, she pretty much covered many things, and she maintained her tempo, and she maintained her calm throughout the scenario. That was good.
Mm-hmm.
But there was a repetition. Like one thing was, mother was not getting satisfied.
Mm-hmm.
So that one thing we should not be continuously telling that I felt we should not be telling continuously that breast milk was not available, not available. So she was asking why and how. So I feel that an apology straight away that these things happen. We take necessary precautionary measures, but sometimes this happens that some mother's EBM gets misplaced, and then we during the feeding time we could not locate the EBM, and then we have to accept the mistake, and we have to say sorry. Like that part was given in the scenario, and I think we were telling that it was not available, which I felt that it should have been different. And number two, some we could have used the opportunity to sound positive in some ways. Though at one place she mentioned that John is otherwise doing good. That can be little bit elaborated more. Like being a 29 weeker, it is a long journey, and we have to take care of a lot of things which we have been doing well, and John also have been doing well, and you have been cooperating really well. So some sentence like that, which will isolate this incident from overall management of the newborn, like which is everything else is going good. And instead of telling it is very rare, the chances are less. We can tell that the chances are less, and uh, we will keep monitoring all those the points she covered. Like after one formula feed, the chances are less, and we will take utmost care to avoid further formula feeds. And we can also add one point that babies whose mothers are not producing EBM, they are on formula feeds, and not everyone develops NEC. Like that, we could have put like that to reassure the mother. So these are few points, I think.
Yeah, sure. Thank you very much, okay, for elaborative feedback. Thank you.
Thank you.
Yeah. All right. Hafsa, do you want to say something? Veena, okay. Rashida, Divya, anyone else? Okay, all right. So now I would like to give the feedback. Okay, Bhavana Kumari, first of all, Thank you for the participation. All right, and yeah, so overall it was good. Yeah, so there are certain things we can improve. All right, and we'll discuss those things. Okay, so what kind of communication session was this?
This was type of critical incident or yeah, medical error incident. I
Apologizing.
Yeah, so no, I can't say it is critical error. Yeah,
not critical but
medical
error.
error, angry parents, you can say, yeah. Yeah, okay. All right. So good. Yeah, so the thing here, the mother is very upset and angry about the feed, like formula feed was given for her baby John, and she was expressing thing like the difficulty in expressing the expressing milk and why the feed was given. So you try to pacify, you try to tell the answer for the same. Yeah. So yeah, I will come, I will begin from the beginning. So greeting. So initial greeting, you say good evening. So in the exam, usually it is in the morning or in the afternoon. So please say good morning or good afternoon. Is that okay,
Okay, sir.
Bhavna? Yeah.
Yeah. Okay.
Yeah, that is the first thing. And after that, you can say, I'm Bhavna, one of the neonatal register working in this hospital. Okay, looking after John. So am I speaking to Eva, John's mother? So that's how you have to you have to uh, introduce yourself and
So
confirm
in
the.
complete one sentence, I have to introduce, or I can introduce
Yes,
in a part like.
you
Oh,
can divide into sentence also, no problem. Okay. Yeah.
okay.
Yeah. So you don't have to say doctor because you are going to tell that I'm a doctor, neonatal doctor looking after baby John. Am I speaking to you, John's mother? So yeah, so you're going to tell that don't have to put doctor in front of the your name. All right. So
Okay.
that thing was done, and you set your agenda. Yeah, I'm here to discuss about John's condition. Is it the right time? Is there anyone who'd like to attend meeting? So that's a good thing. So it's okay. So you can ask here because angry parents and the medication error. You can ask for the usually whenever you are going to do the breaking bad news, we ask for the one of the parents. Okay. So here it's okay. So it's not a hard and fast rule that, yeah, it is done only in that case. It's okay here to ask for the family members.
Okay.
Yeah, that's good thing. And so you try to check the prior knowledge. Okay, understand previous knowledge, understanding what you know so far. When mother told, yeah, doctor, actually, John is born premature, so and so, and having so many problems. I found that nursing staff actually fed my baby with the formula milk. I'm very upset and angry. Okay, so for that you responded yeah, appropriately. I see you are very upset. You have to say you are very upset, angry for the thing that okay, John was fed with the formula milk. So you don't have to say that mother milk was not available at that time, okay? Because it is not given in the step.
Okay.
Yeah. Okay. So I'm very sorry that formula milk was fed. Okay. Sometimes when milk is not available, but we have to feed the baby. Okay. So here formula milk. So sometimes when mother's milk is not available, we do feed the baby with the special formula, milk for the babies who are born prematurely, preterm, isn't it? We
Okay.
we we feed no many times. Okay.
Yeah.
Yeah, and you don't have to add your own thing like in the exam. Okay. So when mother is very upset about it, I'm very sorry that it has happened. We'll make sure that it won't happen. Um, yeah, I can see you are worried about necrotizing enterocolitis. I'm very happy that okay, you brought out this thing here. So Then you could ask about necrotizing and what you know about necrotizing, how anybody has updated about it, how do you know about it? No, doctor, actually. So that thing also you can just try to ask and discuss about it.
Okay.
Okay. So one time feeding with the formula milk, okay, there is very less chance of having it can lead to necrotizing enterocolitis. There are many other factors actually. But currently, the good thing is that John is doing good. Yeah, he's tolerating feeds and
Okay.
yeah, all right. So that's very important. Then mother was having some queries, the questions regarding necrotizing. What is the cause? What are the factors which can lead to necrotizing enterocolitis? You explain about those things, prematurity, IUCR, those things. Many factors, while being, baby being born, while being, born that time can happen, or maybe when sometimes when baby is in the mother's womb, it might happen. But exact reason we don't know. Yeah, you have to say that.
Okay.
Okay. So currently John is not having symptoms of the necrotizing enterocolitis. We are continuously monitoring John. His blood pressure, pulse is they are stable. Am I with you? Are you with me? So you were repeating the sentence like the checking understanding like so you were saying are you getting my point? Are you getting my point? The same sentence was being repeated again and again. So you can say uh,
Okay.
am I clear so far? Are we on the same page? Something like that. You can paraphrase the things.
Okay.
Yeah. All right.
Yeah.
Yeah. So the questions regarding what are the symptoms we should look further uh, in case of neck, in case in John develops. So that's very good to know that you want to know about how they can present in case of necrotizing enterocolitis. Yeah, so you can say yeah, tummy swelling, they won't tolerate feed, throwing up. Yeah, sometimes blood in the poo might be there. Tummy swelling could be there. All right. So
Okay.
and there are like an early phase and late phase, advanced phase basically. So depending upon the phase, so the presentation might be different. Okay, you don't have to scare anything. Like the mother was having, is there any treatment available in case John develops necrotizing enterocolitis? Um, okay, this is a very valid question. Yeah, so there is a treatment available. So initial stage or early stage of the neck, usually it's managed conservatively. That means usually the surgery is not required. But if it is advanced, sometimes they might require surgery. I don't want to scare you, but currently uh, the issue is not that. Yeah. And
Okay. So can we say about the surgery, like because mother is already angry, and if we tell about the surgery, could it be get very angry?
yeah, that's why
If,
it's actually, yeah, you don't have to explain, but if the question comes there, if the mother asks question, then you have to answer because
okay.
that question was asked there.
Okay. Okay.
Yeah, yeah. And
Okay.
so one time you were told like, so yeah, you told I can understand your issues or something you told. Okay, I can understand. So it's very difficult to predict that actually. So nobody can understand mother's pain and mother's suffering. So you can just
Okay.
say that. So I can imagine how difficult it is for you, but you try to apologize, 2, 3 times. That's good actually. And yeah, but I would like to complain. I would like to file a complaint. Okay, I want to know who has done this mistake. Okay, it will. I'm not allowed to tell the name. Okay, so you can say yeah, that's okay, but I'm not in position to tell the name. But we are working as a team, and if the mistake happens by someone, it's a total team failure. But however, the incident reporting already has been raised, so we have informed nursing staff consultant also. Are you with me? So yeah, something like that you have to say. But I want to talk to your consultant. No problem. So I will arrange meeting with the consultant, and at the same time, if you, so she was asking for the complaint. All right. So there is a form available. I can help you to fill up the form, patient advice and liaison service, and all right. So after 48 hours, you will get acknowledgement, and after 1 month, you will get the response for that. Is it okay for you? So like that you have to ask, and yeah, so this is how you have to answer all those questions and queries raised by the mother. So you have to really show the empathy part, like I understand how difficult it is for you to express milk every time. It's not easy. Mother's milk is very, very important for the babies, especially those who are born preterm, born before time. Yeah, I will make sure it happens again, but sometimes if the mother's milk is not adequate, so we have to feed these babies with a specialized formula milk.
Okay.
Are you with me? Okay. But see, thing is that, so it is just a formula milk, okay? You don't have to create so much a problem here actually. Yeah. In case if somebody's milk, some other, mother's milk is fed for this baby, so then that is a big problem. We don't know if that, mother, is having, some issues, health issues,
Yeah.
so in that case, the scenario might go differently. Here, it's not a big issue. Only worry is about NEC. Okay. So even in case John develops this issue complication, so we are in a position to manage that. Right? Yeah. So like that you have to say.
Okay, sir.
Okay. So suppose in case if you don't get time in the exam, it's okay. So you don't have to summarize each and every station. But it's good that you try to do the summary for this case, and I'm happy, and you try to provide the leaflets. So that's good thing you did. All right. So
Okay, okay, sir.
you will
Thank
get
you.
welcome. So you will get somewhere you can say 6. Yeah, you will get 6 out of 8 in this station.
Okay, sir. Thank you.
Welcome. Okay, guys.
Okay, sir. Sir, I have question. So in this scenario, we can tell about the team, like because it is mentioned that nursing staff gave him the seat. So we can say like that it is a whole teamwork, or even we don't need to nominate that person. But can we say like team? It is total teamwork.
Yeah, so that's the thing, like, you should not be saying anybody's name. Okay, first of all, like,
Yeah.
uh, because baby was, needing feed. So the feed was due at that time, and so formula milk was given. I want to look into this matter. So what exactly happened, with the express milk? Mother is complaining that, okay, I gave the express breast milk, but why it was not fed, why it was not given. So I can see you were very upset, angry about it. We make sure the next time it's not misplaced or like, but I will tell you. So in case if the milk is not available, we do feed babies. Okay, so and we have seen this baby doing well, and
Okay.
yeah, this complication won't happen in all babies. Some babies might develop,
Okay.
but that too, you told like it's for prolonged feeding, from prolonged formula milk is one of the risk factor. I agree with you. It's one of the risk factors, and if it is given for a long time, there is a chance, little chance, some chance you can say. Okay,
Okay, sir.
all right.
Okay, thank you.
So
Okay.
any queries, guys?
Yes, sir. I have
Yeah,
one query.
yeah,
In
please.
this scenario, it was written clearly written that nurse fed that and it was missing. So she want to ask like, it's this incident keep happening or like that, how we will answer?
Yeah, we'll
Like,
make sure this incident won't happen again and again. So for that, so we are going to have the meeting, and yeah, already the incident statics form is filled up and it is raised. So we'll discuss, okay, and we'll make sure it won't happen in again in the future. But yeah, but see, thing is that it is just a formula milk. It's one feed, so you have to just tell that it won't lead to necrotizing enterocolitis. One single
okay,
feed.
sir. And what about it was written that mother is having problem with expressing breast milk. So can we offer support or any group or anything or any special nurse in this or no?
Okay. Uh, so yeah, that's a good point actually. So you can support this mother for expressing breast milk because she's having difficulty. So is there any issue with the expressing breast milk, or is there any other health issues for that? So I will discuss with the support group, and you can lactation support group is there. So they can come and assess, can help you, they can talk to you in case if you have difficulty in expressing. Okay, sometimes the pump is also available, so we can talk about it also. What exactly the issue is that you can discuss about it. Yeah, that's a good point. Okay, guys. Thank you.